Monday morning to you. We begin today with a focus on your health, and with no warning signs or symptoms, it's pretty hard to tell when you have a problem with your liver. But some 5 million Americans have hepatitis B or C, and 75% of them are unaware they have it.
Our first guest is known as the Liver Lady. Thelma Thiel is the Executive Director of the Hepatitis Foundation International and is here today with what we need to know to stay healthy. Good morning, Thelma. Thank you so much for joining us.
Well, thank you for having me.
Yes.
First of all, I want to ask you, how did you get the nickname the Liver Lady?
Well, I've been at this for 40 years. I lost a 4-year-old son 40 years ago on Christmas Eve with a very rare liver disease. To this day, they don't know what causes it, but we can save lives by prevention. So that's why I'm known as the Liver Lady, because most people don't know very much about the liver. It's not been our schools. Even the physicians aren't really up to date on a lot of the new things that are going on with liver disease.
Well, let's talk about liver health. First of all, we've got a graphic of what a healthy liver is. What does the liver do in the body?
Well, it has about 500 functions. People don't realize that it's involved in everything that you eat, breathe, and absorb through your skin has to be refined and detoxified by the liver.
So it's important to keep it healthy.
Well, again, most people don't realize that their liver is their internal chemical power plant. And one of my messages is that the liver cells are the employees in your power plant. And what you're doing with drugs, alcohol, and environmental pollutants and hepatitis viruses, you're killing off those employees without your knowledge, because the liver's a non-complaining organ. I couldn't imagine why there was so little known about it. But back in the mid-70s, there was only 1 hour being taught about the liver in medical schools.
So even doctors weren't being educated.
That's right, because the liver's a non-complaining organ. People were not going down to Washington to ask for our fair share of money for liver research. I was one of the first people to go to Congress to ask money for liver research. So that's kind of where I'm known as the Liver Lady.
The Liver Lady. It's a pretty arduous situation then if it's a non-complaining organ and you don't really have any signs. What do you have to do to be proactive to make sure that it's...
Well, again, we feel very much, 75% of the people that have hepatitis are walking around. I call them the walking wounded, because they don't know that they're infected. How do you get them to look back 20 or 30 years when they were participating in some risky behaviors and they've forgotten about it? They've blocked it off because they don't, they don't have any signs. They feel fine. They go to work every day. So, I'm not in trouble. So we take a step back and tell them how important the liver is and how it can be damaged. Those liver cells are the employees, again, and when you kill a liver cell, that's called cirrhosis. That scar tissue is called cirrhosis. People just don't know what cirrhosis is. Well, you keep assaulting it with drugs and alcohol and hepatitis viruses, that scar tissue goes all through the liver like the gristle in the meat, and when the liver tries to regenerate, it regenerates in knobs in between the scar tissue, and that blocks off the blood flow coming, because about 95% of the nutrients the food that you eat, is carried over to the liver, where there are all these wonderful liver cells that turn it into all the elements that keep you alive, alert, and healthy. It makes immune factors to keep you from being a sitting duck for every germ going around. It makes clotting factors. It gives you the energy that you need to get up out of bed in the morning. It's just a miracle worker, and yet people just don't know how important it is. So if you realize how important, of course, one of the first things that happens when you have a liver problem is your engine is slowing down. I tell people, would you ever think of putting bacon grease in the engine of your car? It would muck up the engine big time. What do you think about putting in pizza burger, French fries, Krispy Kremes, and washing it down with beer? I said, you're putting that into your engine, and you expect it to keep working for you. So it's kind of we make it personal, so that people understand why they should be taking care of this wonderful, miraculous organ that they have inside of them.
Well, let's take a look at a damaged liver. And you mentioned that it's called cirrhosis. I always thought cirrhosis was damage done by alcohol, but cirrhosis is any kind of damage done to the liver.
That's right. That's right. My son had cirrhosis at 2 weeks of age. Something had destroyed the bile ducts in utero, and he couldn't get the bile out of his liver. Bile is essential to giving your body the capability of absorbing all those vitamins and minerals. He had 2 fractured hips and a fractured tibia before he was 2 years of age because he could not get the bile out of his liver. So it's telling little stories about how important the liver is and what it does for you in a day. I usually pick on the man in my audience. I say, you know, if you cut yourself shaving this morning, you'd still be mopping up your chin all day if it weren't for your liver making the clotting factor to keep you from bleeding to death. I hope when you reach for the toilet paper to stick on your bloody chin the next time you think of your liver. You know, just making it personal, and so people will react and will take care of it. When I hear about all the problems with obesity, people don't realize that everything that you eat has to be cleared through the liver. The people who have HIV, you know, they're on wonderful medications, but they don't realize that the liver has to process all of those medications. Some of them are participating in the same risk behaviors that got them infected in the first place, and they're getting hepatitis C, which is damaging the liver. So they can't process the drug, so they're dying of their hepatitis C. It's critically important that people take care of this liver, and we've got to get that information out to our young kids. It's not being taught in the schools. The teachers don't know about it. Even some of the physicians are not really up to speed on it because it's not been taught in the medical schools.
So we have to be proactive about our health and talk to our doctor. Is there any kind of testing that we can be done? I know for hepatitis there is.
There's a test, but it's not a routine test. You have to ask for it. And if you don't know you have hepatitis, you're not going to ask for
Exactly.
it, you know. So we focus in on trying to educate the intermediaries. We call them the nurses, the nurse practitioners, the physician assistants. They're the ones that are talking to the patients to get them to do a better history, because it's such a guilt factor related to hepatitis. You know, I think, was I a druggie or whatever, this kind of thing. But again, if the doctor's going to say, have you ever used IV drugs, you're probably going to say no.
Right.
You know,
you have to be
you
truthful.
Say, well, I say, if you've had an endoscopic exam, have you had extensive dental work, have you ever had a blood transfusion, and then you go into the others, you know, and say, have you ever done any one of these? I will test you for hepatitis.
All right, Thelma Thiel, the liver lady. Thanks so much for joining us today.
Well, thank you.
Thank
and
you,
educating
Thelma.
us very little. There's a lot more to learn about this, I'm sure.
For more information on hepatitis and learning about the liver, log on to our website at WTVR.com/VTM.